Greetings. I'm Sam Coleman, and I'm calling in from Orange County, California. I'd like to share my screen for my talk. Wounded American veterans can't survive in a wounded American society. My thanks to the Peace Tour organizers for inviting me. My fellow presenters are people whose work I very much admire. I'm honored and I'm humbled to be included with them. When and how are America's veterans wounded? And there are many. Combat operations are obviously one source. After Vietnam and the Gulf War, the United States then engaged in major combat operations in Iraq, Operation Iraqi Freedom, and Afghanistan, Operation Enduring Freedom, for almost 20 years. Our troops have been exposed to lethal hostilities elsewhere since the end of World War II also. When we include small wars, America has been at war since World War II constantly, except for the period of October 15th, 1976 to November 4th, 1979, and 7 months in 1990. Wounds from America's wars in Vietnam, Iraq, and Afghanistan have much in common. Blast injuries from improvised explosive devices, IEDs, and booby traps are more frequent than gunshot wounds. Explosives cause traumatic brain injury, musculoskeletal injuries, loss of limbs, and hearing loss. Lower mortality, but higher morbidity. Our soldiers have survived wounds that would have killed them in past wars, thanks to more effective evacuation and shock trauma treatments. Surviving victims experience a lifetime of pain, though. The invisible wounds, PTSD, moral injury, and suicidality. The post-traumatic stress disorder diagnosis originated in soldiers' experiences of mortal danger in the Vietnam War. Symptoms, sometimes debilitating, include hypervigilance, anxiety attacks, intrusive thoughts, severe sleep disturbances, nightmares, emotional numbing, and avoidance behavior. How extensive is PTSD among US veterans? Vietnam theater veterans diagnosed with PTSD when reported in 1990, 15% plus of men and 8% plus of women. The estimated lifetime prevalence for Vietnam War era veterans, 31% for men and 27% for women. PTSD from wars after Vietnam, Gulf War, 10% plus. OIF and OEF, current diagnosis rate of almost 14% as found in a 2008 study. Who's most susceptible to PTSD? Major Danny Surgeon put it really well. Enlisted, younger, browner, poorer, less educated, more rural than their civilian counterparts. The price tag of wounded veteran care to American taxpayers. The Department of Defense has not provided reliable statistics for the number of injured veterans. Nevertheless, care for post-9/11 war veterans will reach between $2.2 and $2.5 trillion by the year 2050. US post-9/11 war spending totals will be over $8 trillion. Moral injury, MI, an evolving category of psychological pain. Researchers originally identified two causes. One, perpetrating or witnessing acts that violate one's deepest sense of right and wrong. In short, atrocities. Two, experiencing betrayal in a high-stakes situation at the hands of a superior or authority figure. Both of these causes of moral injury result from the American way of war today, protecting unpopular, corrupt regimes from domestic insurgencies. Symptoms of moral injury overlap with PTSD symptoms. Veterans afflicted with moral injury suffer symptoms resembling PTSD, but they also feel self-revulsion and intense morbid fear that they will contaminate their loved ones. Another difference between PTSD and moral injury: moral injury instills a profound sense of absolute lawlessness. I got away with it. Thus, since no one is held accountable, no one can grant absolution either. If no one can punish me to restore the world, I must punish myself. Worse yet, veterans with PTSD fear for the safety of their loved ones. Veterans with severe moral injury fear that they might be the loved ones, they might be the ones to harm their loved ones because they have violated their own behavioral boundaries. The universality of moral injury. Moral injury isn't confined to a few religious men and women who have a sensitive conscience. I suggest that the experiences that cause moral injury assault the mirror neuron system, MNS, in the inferior frontal cortex of the brain, the area that's responsible for empathy. Significance of the mirror neuron system hypothesis: not all individuals have a sensitive MNS. I suspect that those with an antisocial personality disorder, formerly known as sociopaths, probably have a poorly developed MNS region in their brains. Speaking as an anthropologist, past egalitarian societies would not have tolerated such people, but today many successful military and political leaders show such sociopathic tendencies. How extensive is MI among veterans? There are now several assessment tools used by clinicians, but research is in an early stage, and much of the effort involves distinguishing MI symptoms from PTSD. This much is certain: moral injury increases the veteran's vulnerability to suicide. Suicide among service members and veterans of the post-9/11 wars. Those killed in post-9/11 war operations, 7,057. Those who died by suicide, 30,177. This is the opposite of what we should expect in statistics. Adjusting for age and sex, America's veteran suicide rate is 52% higher than civilian suicides. Until recent war, the veteran suicide rate was lower. Veterans of the post-9/11 wars are dying by suicide in even greater proportion, especially in the 18 to 34-year-old age group. Where are suicides increasing most among veterans and active duty personnel? They are young, in their 20s, white, non-Hispanic, males, in the Army and Marine Corps. More about recent suicides. The suicide rate is higher among those who have not deployed. The first 6 months or so after discharge are particularly perilous for suicide risk. We need more attention to the harmful role of the military and its members' lives beyond combat. The military offers members a structured life and a cause that is something bigger than me. The military depicts itself as a family. That was a persuasive ideology in pre-war Japan also. The lower ranks in the US military experienced disillusionment. Corruption and systematic abuses of power have betrayed that image of family. Recent losses aggravate disillusionment. Our country's military defeats since World War II contradict the ideology of America's military as protector of the weak and champion of democracy. The failed missions have resulted in post-traumatic futility syndrome among veterans. The most intimate betrayal of family, sexual assaults in the military. An estimated 20,500 service members are assaulted by fellow military personnel every year, but only 6,290 cases were reported in 2020. Fewer than 1% resulted in a conviction. The military elite have been resisting reform of the system for decades. We can't expect veterans to heal in a sick society. Clinical interventions are valuable but inadequate. Veterans rely on their families, workplaces, and communities as places to heal and gather strength. But what if the families are fragmented, the jobs insecure, alienating, and poorly paid, and the communities drained of resources? That's the United States today. The most dramatic evidence of a sick society: deaths of despair. Deaths of despair represent the combined mortality causes of suicide, alcoholism, and drug overdoses. There have been so many of these deaths in the US in recent years that they have pulled down overall life expectancy for the whole country. Who's been hit hardest? The group experiencing the most carnage so far is white males with only a high school education in the 45 to 54-year-old cohort. They are the primary victims of automation and job flight resulting from globalization. Understanding veterans and civilians' deaths of despair causes common to both civilians and veterans: a sense of burdensomeness to loved ones and intimate others, frailty in marriages resulting from economic precarity. Poor men make bad husbands. An unmet basic need to belong, frustrated by hollowed out communities. The people of Europe and Japan have suffered also from globalization and automation, but working people in the United States have been harmed even more because the American political economy is so corrupt. As a result, we have the worst polarization in wealth and the weakest social safety net protection, especially in healthcare. The signs of corruption are so blatant that no one sees them. A proven fact: the more money an American has, the more likely his or her policy preferences will be enacted. I couldn't resist. Jigoku no sata mo kane shidai. If you have enough money, you can ignore a letter from hell. Two examples from present-day politics of this corruption. Presidents Bill Clinton and Barack Obama both began life in near poverty, but by the end of their presidencies, each had a net worth of over $70 million. For comparison, when Emperor Akihito abdicated the throne, his net worth was $40 million. Here's a valuable study: Case and Deaton's Deaths of Despair and the Future of Capitalism, 2020. Translated into Japanese, Zetsuboshi no America. COVID-19 reveals the political and social rot also. The US has the highest COVID-19 mortality of G7 nations. Why? A weak public health system, inadequate healthcare, poor education, and for-profit media and social media that spread confusion, resentment, and lies. Veterans are suffering from COVID-19 even more. Veterans' COVID-19 mortality rate exceeds the civilian populations. That's because veterans are on average older, experience more social isolation, respiratory exposure to toxins, and lack of treatment for chronic pain. Where to turn as loved ones of veterans and concerned citizens? Clinical interventions for veterans are improving, and we should demand more and better medical science. The most effective solutions, however, require communities coming together to help heal veterans and their loved ones, using the most comprehensive understanding of the ultimate sources of pain. The significance of moral injury here. Quoting Tyler Boudreau, Operation Iraqi Freedom Marine veteran, moral injury takes the problem out of the hands of the mental health profession and the military and attempts to place it where it belongs, in society, in the community, and in the family. Precisely where moral questions should be posed and wrangled with. It transforms patients back into citizens. For Japan, learn from abroad has a new meaning. Ever since the Meiji, Japan's leaders have encouraged studying other nations for inspiration. In the late 20th century, the nation with the most to offer was the United States. No longer. The situation is reversed. You in Japan must see the United States today as a path of militarism and corruption that your country must not follow. Cherish your communities of peace and strengthen them through mutual aid. We in the United States chapters of Veterans for Peace cheer you. We pray for your success and earnestly hope that you will inspire the way for us. Thanks so much for listening today. Take care.